Hey everyone, Daniela here from the Obstacle Doc, and today we are talking about hip abduction exercises or exercises targeting the glute complex. So we are going to start with maybe the most basic, what is considered the most basic level with a clamshell, and progress into a little bit more difficulty, a little bit more challenging exercise such as a side plank. So we're going to start with our basic clamshell. This is kind of the most arguably boring, easily given out exercise. We do have a little bit of a spin on this, or just how we like to make sure our clients are doing this. So you're going to start laying on your side. The leg that is on top is the leg that's going to be working. And I always like to give people the option that if they feel like they need it, they can do this up against a wall. So I'm going to pretend to be that wall behind here. So you are going to have your hand on your hip. We like this cue to make sure that you're not opening through the hip and using too much of that rotation from the middle of the body for overcompensation of what the leg is doing. So hand stays here. You can do whatever you want at the top of the body, and we're going to lift up against the band, against that resistance, into our abduction, and then slowly come back down. Things that we're thinking about whenever we're using bands or any kinds of weight for that matter is not having a choppy movement. So he's going to smoothly open up and then smoothly come back down. He's keeping his feet together. Feet are staying together to bias that abduction, a little bit of external rotation. As you can see, it's not a big movement. Go again. It's not big. If he gets a little bit wider than this, he starts to roll backwards towards me. So that's why a wall or having that hand on the hip is a really nice cue. So the next progression would be a straight leg raise because we have a longer lever arm now. We can keep the band at the thighs or just above the knees to start. You could also take it down to the ankles to make it even more challenging. For the sake of time and demonstration, we're just going to keep it here. So both knees, toes, hips are all facing the same direction. Same thing with the hand cue. We're not letting ourselves roll and open back. And we're going to take this leg straight, just up. You want to go to about hip in between elbow height. We don't want to shoot past that, or else we're going to start to compensate through the rest of our body. So just to where we feel that resistance, probably at about our wrist height, and then going back down. Again, you're feeling that work come from the top leg. Bottom leg is just stabilizing you, but the top leg is what is working to lift and lower this side. So if we want to take this up even another spice level, we can go into a side plank. What's important to remember for a side plank is that the side underneath is actually the one that is working in this case. So before, where he was laying on his side, moving his left leg was taking the load. Now that he is going into the side plank, the right hip is what's taking the load. So our elbow is going to go underneath our shoulder, and we are going to lift up from our hips, pressing down through that knee. And now this glute med min, is what is pushing away from the ground into that abduction. So he can hold there for a couple of seconds. He can also repeatedly come down and come up. You want to think about still keeping yourself in a straight line from the shoulders to the knees, between the hips. And again, we're using that right glute to push us into abduction. If we want to make this even more challenging, he can start to lift up this top leg into abduction as well, a little bit of external rotation. So now not only are we using the right side to help lift us up, stabilize us, but we're using the left leg to move additionally as well. This can be the straight leg raise. This can be the clamshell variation. Band can be at the knees. Band can be at the ankles. Knees can both be straight or bent. So right now we're taking a bent knee variation, but he could straighten both of his legs into a full plank position, or full side plank position, I mean. And so now this is a longer lever arm. It's a more challenging movement. This is a full body exercise. This is not strictly just targeting the glute abductors at this moment.